right, we definitely need all hands on deck now. The congressional budget wish list essentially came out. We knew it was kind of in the works. We knew kind of what they were going to target, and it turns out we were right. So they're going to go after things like Medicaid, SNAP, which is food stamps, housing, Section 8 housing, affordable housing, and it looks as though they're going to try it through the reconciliation process. The reconciliation process is they just need a simple majority, 51%. They don't need 60 votes in the Senate or anything like that. They just need 51 votes in the Senate. No filibuster or anything like that. But in order to do a reconciliation, they can't increase the deficit. So what the ultimate goal is, trillions of cuts to taxes, predominantly for the wealthiest. And so we're talking to trillions of dollars of cuts there, and they have to offset it. And they're not going to touch Department of Defense, obviously, even though I'm an old Marine Corps sergeant, and there's definitely a lot of places in the military that you can save money. But they're not going to touch the Department of Defense. Looks like they're actually going to increase the Department of Defense, Department of Homeland Security. They not going to touch Social Security as of right now, but they don't necessarily have to, because the automatic cuts, everybody that watches my channel know that the automatic cuts are already going to come in a few years. So they might mess around with the edges. They're definitely messing around with the customer service Social Security, provides or doesn't provide. Politicians have been trying to destroy customer service for quite a while, and they're doing a phenomenal job. Social Security is at a 50-year low in terms of staffing, so it's almost impossible to get in there and get help. So Medicare, we'll see what's going on specifically with that, but actually cutting Medicaid is going to affect a lot of people that are on Medicare as well, those dual eligible plans. All right. So in order to give tax cuts, which predominantly go to the richest, right now we've got 244 of the richest Americans have more wealth than half of the U.S. population. Yeah, the top three, we're talking Bezos, Musk, Zuckerberg, those three people combined have about as much wealth as the bottom 40% of Americans. It's yeah, so it's crazy. So I think they need more. I think we need to go out there and maybe have some garage sales and some, sell some lemonade, and they really need that money. Elon Musk has got 11 children, so come on, he can't just leave them $100 billion each. Come on, he needs more help. Come on, we need to buck up here. As one politician said, there's going to be some tough times in there. Obviously not for these people, but it's going to be tough times for us. All right, so why all hands on deck? Because if this doesn't apply to you, says, I don't care, I'm not a Medicaid, bye. This channel is all about helping people around you. So go out there, and people that are on Medicaid, food stamps, the elderly, the disabled, please reach out to them and say, hey, number one, make sure you're getting everything you can before it goes away. And number two, call your politicians. If you think Americans, are awesome like this, is that we help the less fortunate, then please call your politicians. Those are the numbers down there, the U.S. Capitol switchboard. So you call that number and you just tell them, where you live, and they'll connect you to your two senators and your, congressional representative, the House representative. You can call the White House there, get onto the politician's website. And there's most politicians have, I think almost all of them have a little button there that you can say, I need help with a federal agency. And you can click on that and say, well, what help do you need with a federal agency? Well, I need agencies to help people out that are in need. And I also need for you to improve customer service. Okay. What is the link between Medicaid and Medicare, and why in the thumbnail did I put Medicare cuts are coming as well? Because there's a system called Medicare Savings Program. And I've got a lot of questions here. This is also a live Q&A. I'll go down the list here and talk everything probably about another 5 or 10 minutes, and then I'll get into all your questions. So I see tons of questions already. All right, so the Medicare Savings Program. So for those people that have Medicaid, and the difference, Medicare is the one you sign up for at Social Security Administration. Your Part A and Part B. Part A covers the hospital. Part B covers the doctors, the outpatient type stuff. Yeah, the new RFK Jr. the guy that's in charge of all this doesn't know that difference. So I think he definitely should be in charge since he anyway. But that's you sign up for at the Social Security Administration. Then obviously, Part A, Part B alone. People get Medicare supplement plans, Medicare Advantage plans, the Part D prescription drug plans, but that's Medicare. That's a federal program. Medicaid, in some states, they call it a little different. In California, they call it Medi-Cal because it's California. They got to do everything different. Anyway, but Medicaid is administered by the states. And that is essentially a welfare-based program. Low income, low resources, doesn't matter how old you are, if you're disabled or anything like that, you might be able to get Medicaid. So the people that get Medicaid and are also eligible for Medicare. So if you're disabled and you get Medicare because you've been on disability for 2 years, or you turn 65 years old and you're eligible for Medicare, there's this Medicare savings program, and please go out there and share. You've people that are having difficulty paying for that Part B premium, the $185 a month, tell them to go down to Medicaid, file for Medicaid while it's still there, and see if Medicaid, there's different levels of Medicaid depending on your state, and they will pay for your Part B premium. And but the thing going forward, why we need to reach out to our politicians and make sure this doesn't happen, if you agree with most of my viewers that it shouldn't happen, then contact your politicians, because what happens is if Medicaid goes away, therefore that help to pay for the Part B goes away. And there's going to be a lot of people that say, well, I lost my Medicaid and now Medicare, Social Security, they're taking out of my Social Security check. I can't afford that $185. I'm just going to go ahead and cancel Part B of Medicare. And they're not covered. They have no health insurance. So they're like, I need the $185 now. I'm not sick today. And I'll just try not to be sick or get injured in the future, but I need that $185. So there's a lot of people that are depending on that. So we need to reach out and stop that. And there's also people that have Medicare, they're receiving extra money. Those are called Medicare Advantage dual eligible plans. And viewers to my channel know I always recommend a Medicare supplement plan N and G, so you don't have to prior authorizations and networks and all that stuff. So you can reach out to my partners there at Medicare chapter. They can help you with all that. But people with Medicare and Medicaid, they are dual eligible. They're eligible for both. And those that are dual eligible are also eligible for a Medicare Advantage dual eligible plan. And if they have Medicaid, they can't get a Medicare supplement. The only thing they can get is a Medicare Advantage plan. So they get those Medicare Advantage plans, and those are the ones you see all the time advertised, with all the, the extra grocery cards and the, the dental and vision and all that, all the really good benefits, depending on your particular area. But they're kind of advertised kind of scammy, but they do exist. They do exist, but it really depends what's available in your area. There's a lot of, YouTube and Facebook out there that says, oh yeah, you get $1 billion in free ice cream and unicorns and stuff. But yeah, check to see what's available in your area. And if you don't have that, definitely get it before they're cut. There's 9 states that say that have automatic trigger laws, essentially, that if the federal government stops funding, because Medicaid is funded by state and federal monies. So there are about 9 states that say if it's cut, then if the federal funding essentially ends, we're going to end it, period, done, we're done. And a lot of other states are probably going to follow suit. So if you've got Medicare and Medicaid, somebody, make sure they get those benefits while they can. Get the extra grocery card, because again, they do exist. You could get an extra $100 a month or $200 in travel and transportation back and forth to hospital or whatever the case may be, and dental. But if you have those, make sure that we don't see Medicaid going away this year, hopefully. But funding may be cut back, and there are cases where you will be downgraded. So there's several levels of Medicaid. You have QMB and Slim B and QI, and some people have Medicaid, but they're not receiving that $185 a month help. But they still have Medicaid at certain levels. So it really depends on your particular state. Some states are cheaper than others, and so. But use those cards. If you don't have one and you have Medicare and Medicaid, reach out to chapter or whoever you trust to help you with your Medicare plans, and they can help you out. This is also the Medicare open enrollment period. So January, February, March, if you have a Medicare Advantage plan that you didn't check when you were supposed to back in October, November, you can still do that now. You have one opportunity to switch. If you lost your doctor or you checked it and say, oh my gosh, it's really been downgraded. Definitely check to see if you can switch. There's different special enrollment periods where you can switch, but now January, February, March, pretty much anybody can switch a Medicare Advantage plan one time. And probably more importantly, if it's good for you, you can switch out of a Medicare Advantage and go back to original Medicare and get a Medicare supplement plan, the plan N and the G. Why most people don't do that is because they don't know about it. And yes, there is a monthly premium for Medicare supplement plan. So a lot of people it's just not in their budget to get a Medicare supplement plan. But you still have to go through health underwriting. So if you're healthy and it's in your budget to get a Medicare supplement, I would definitely at least check it out. At least check it out. Again, you can reach out to my partners and our sponsors at Chapter, and they can help you out. All right. So again, this is not only for you. This is look at everybody around you, your friends, family, the little old lady down the streets, everybody, and see if any of this information can help. Then we definitely need all hands on deck. And even if you don't know anybody, please pay it forward and reach out to your politicians and say no. If you want to give tax cuts to billionaires and millionaires, then whatever, but don't take it out of the mouths and the health care of people that really need it. So I think we're as a country, we're better in that. Lynn Johnson became a member, silver member. Thank you very much. Appreciate it. All right, let's get into I thought Ed, yes, I said yesterday he wasn't going to be on tonight. Yes, I said that yesterday. I was going to take a day off today, but then this news came out. What we knew was going to come out, and I had to jump on here. So sorry. Let's see. Applied for Medicare and Social Security December 9th and have not completed as of today. Is that normal time frame? No. Normally, no, but this is, again, 50-year low in terms of staffing. Oh, let me throw up one last thing here for um, all the people. So if you know people that have the Medicaid and food stamps and everything like that, make sure you haven't watched the video I did about a month or two. That's a terrible thumbnail, but that's all I could come up with that day. But anyway, watch that video I did. It was about a month ago I did this, and it's 50 different programs that might make your or someone life better, easier. So I go into 50 different programs, Section 8 housing, affordable house, energy assistance, and all kinds of different programs that just might make your life a little bit easier, or someone you know. So make sure you check out that video as well, or send it to your friends or family. Okay, let's see what else kind of questions we got. Someone was asking before we began about they had their earnings record was incorrect. I don't see that question here, but I'll go ahead and answer that. So number one, perfect, awesome that you're checking your earnings record. That is the most important thing when you're about to file for any type of benefits, disability, retirement benefits, is because Social Security determines your benefit amount on how much you actually paid into Social Security and your high 35 years. So go into SSA.gov, set up a My Social Security account, check your earnings record. Particularly, we're coming up on tax season. Tell all your young people in your orbit to go in there after they file their taxes to make sure Social Security has the correct numbers. Because if they don't, then you're going to get the wrong check for the rest of your life. So someone found something incorrect on their earnings record, and how do you fix it? Pretty easy. Just provide the W-2, go in there, the 1099, your tax returns, or whatever the case may be, and you show them that here it is. Usually what happens is somewhere along the line, your Social Security number was transposed and 1-2 instead of 2-1 or something like that. And those earnings are in what's called a suspense file. So they're just kind of sitting out there in limbo. So you go in there with the W-2 and oh yeah, somebody typed it in wrong. And so here's your earnings. And if you're currently receiving benefits from Social Security and you find something like that, 2, 3, 4, 5 years later, They will fix it, and if it increases your benefit amount, they will give you all that back pay. So if you found something 3 years ago that was a mistake that's going to increase your benefit by $10 a month, they will increase your benefit $10 a month going forward and give you all of that money back. So it's they fix it, and it's pretty easy once the computer system does it all automatically. So um, let's see. I'm just jumping around here. I'm very concerned about my grandson who has autism. He's 23 and he is very efficient. My daughter taught him everything. He receives Social Security disability, I think, and SNAP and Medicaid. So yes, yes, definitely take care of your grandson and all the grandsons out there that receive these benefits. Contact your politician. Let me throw that phone number up there one more time. Or I'll throw up this that I usually pop up here. Let me get rid of this here. All right. So yeah, your senator and representative, the U.S. House, the U.S. Capitol switchboard. There's the number there. The president. Again, go onto the website. Go into social media for your politicians and say, "Hey, I heard you guys are trying to cut Medicaid. What's going on with that?" If it's if it's one of those things where they kind of play around with they do a bait and switch. They say we're $36 trillion in debt. We need to do something about the deficit, and therefore we need to cut benefits. Whatever. Okay, I could maybe see that, but instead of actually paying off the debt, they're just giving more money to, the majority of the money going to the rich. Yeah, sure, they're giving us a couple of pennies as well, but most of the benefits are going to the super rich. It's kind of like saying, okay, you and your family, you're $10,000 in debt. And okay, we really got to save money. Okay, we'll cut back on Netflix and going out to eat and walk to work or something like that. Okay, we saved $1,000 a month, so we'll put that into we'll pay off our debt. But instead of paying off your debt, it says, hey, we're saving $1,000 a month, so I don't have to work as much. So I'll reduce my work, and I'll get $1,000, and somehow the debt will automatic. It's like, wait a second, you just so either politicians are really stupid at math or they know exactly what they're doing. And yeah. Why are you fear mongering? Don't think I am. Check out the news and check out the budget. And yeah, it's right there. RFK Jr. will be making changes for good and for bad. The alphabet agencies, medical corporations, big pharma, insurance companies have been destroying people's health while profiting. Yeah, I agree with it 100%, Carol, that some of the stuff he's saying about, food additives and stuff like that, I 100% agree with that. Yeah, so if just like anybody, the video I did yesterday was about Elon Musk and Trump, about their plans for Social Security. If you do the right thing, if then we should be behind you. If not, then not so much. Don't retire now and risk your life savings on a single illness that would wipe you out. Okay, it looks like it might be a response to someone else. I know a few MAGA voters on disability and Medicare. They wish they could change their vote. I said, why? He is just doing what he told he would do. Yeah. Again, he said that in terms of Social Security, which is the specialty of this particular channel, helping you get all your benefits. I'll try to find some questions about that here in a second. But yeah, he said he's not going to cut Social Security benefits, and he's not going to raise the retirement age, which is beautiful. But the cuts are happening, and something needs to be done. It just can't watch the place burn down. Is this true? Widow is not a U.S. citizen, green card. If she wants to get widow benefits and live outside the U.S., she needs to reside in the USA for a minimum of 5 years before moving back to the home country. That really depends on the particular country. Every country, not every country, but most countries have what's called a totalization agreement with the United States. So let's see, someone in the Philippines, that's probably correct for somebody in the Philippines, but the totalization or agreements are completely different. If the surviving spouse is in Japan, and the United States have a different totalization agreement. So we kind of it's different depending on what particular country. I think Germany is a different country too. I just talked to somebody in Germany, and yeah, so there is a let me. I will put it in the Q&A. It's the payments abroad screening tool, and Social Security has a cool little tool there, that you just put in where this person lives, if they're receiving benefits, are they U.S. citizen, green card holder, or whatever like that, and it'll tell you whether that person can get benefits based on that particular country. So people should know that they can get good information about Medicare and dual eligible Medicare Medicaid options from state health insurance programs. Every state has a SHIP network. Yes, 100%. When I worked at Social Security, we couldn't tell people, you should, enroll in this particular plan because those are private plans. We just told people, yeah, you need to find it, and SHIP is it. But one of the problems with SHIP is they're volunteers, and some we found in my office in my particular state, they're volunteers, and I will never say anything bad about volunteers, but yeah, and so there's that. But yes, available in every state. What are disabled Americans that are 100% disabled from birth, SSI, then kids and adults are not going to make it if they leave their checks? Yeah, that is, so we're talking about, these cuts, that they're proposing to pay for the tax cuts, the cuts to these, mandatory, um, Medicaid, SNAP. I think I forgot to add one of the most important, SSI, supplemental security income, because supplemental security income, SSI, that is a program administered by the Social Security Administration, but that money does not come out of the Social Security Trust Fund. That comes out of general taxation, and therefore it can very well be a target of these cuts. And don't let politicians tell you that Social Security adds to the debt. Social Security, and we're not talking about SSI, we're talking about Social Security retirement, survivor benefits, spouse benefits, disability. None of that adds to the debt. It is funded separately through FICA. It is not added to the debt. Um, the $2.6 trillion that Social Security, that baby boomers have essentially put into savings for their future, that money is in obviously the general fund, and just like the old Jimmy Stewart and It's a Wonderful Life, it's in that person's house and that person's house, but that's a debt. It's kind of like if you're an uncle and your nephew comes to you and says, you're an uncle, you got $100,000, you're good, you're prepared and everything. And your nephew comes to you and say, "Hey, uncle, can I borrow $1,000?" Sure. You'll pay me back next month? Yep, I'll pay it back next month. Okay. And then next month you go and says, "Hey, you said you'd pay back that $1,000." And then the nephew says, but if I pay back the money I told you I would that owe you, I'll have to borrow that from someplace else and I'll be in debt. So the debt is going to increase. Well, that has nothing to do with the uncle. That's your issue. So that's kind of, but politicians like to play fast and loose with, yeah, saying, "Hey, it's all about the deficit and stuff." But yeah, not necessarily so. Today has been the worst. I was already beat down. Now I just want to throw in the towel. No, no, that's what politicians want us to do. Number one, they want us to be divisive and, call each other, liberals and Democrats and communists and fascists and stuff like that. They love that. That's a spectator sport for them. So they like to separate us. But, vast majority of Americans support Social Security, so we shouldn't fall for it. And we shouldn't just give up. That's another strategy of politicians, is to make everything so confusing. We just kind of give up and say, well, forget about it. Just do whatever you want. And so we shouldn't do that. So, you know, um, give your politicians a call and give them a piece of your mind. Let's see. Thank you so much for New Mexico. You're welcome. Abolish the FICA cap. Yes, absolutely. And we've got some more. Kabiru donated, supported $1.99. Appreciate it. Thank you very much. Lynn Johnson became a silver member. Thank you. Supporting the channel. We appreciate it. Either quit your unchecked political filibustering or have someone knowledgeable on your show to counter your fear mongering. I'm here for facts, not fear-based political biased opinions. Well, bye. Yeah, it was nice knowing you, Ken. So, yeah, they're sitting somewhere somewhere in a cave with 1960 technology that's getting fixed. Also, they said they're not touching Social Security. Yeah, the Elon Musk talked about that. The infamous limestone caves. Actually, those are actually good caves in the sense of there's what 98. It's called Iron Mountain Repository. It's a private company, and they started out with, I think it was a mushroom cave or something like that, and they're really good. They're because they're cool. They don't have to air condition them, and they're low humidity. Um, Hollywood uses them for the old classic films. That's where all the classic films is. 98% of Fortune 1000 companies throughout the world use those caves. So those are actually, so the Social Security Administration uses caves like that. And OPM. But yeah, he was talking about OPM, federal retirees, people that work for the federal government and that retired. The Office of Personnel Management, they said they use those caves, and it's not, so, but that's not Social Security type stuff. But yeah, the Social Security Administration does use those caves. I've sent thousands of old disability files to those caves because that's where they're stored. So I live in California. Also, Elon Musk shouldn't be in our business, period. Keep this paws off our funds. Stay in the lane and out of our homes, period. Yeah. Um, I agree with you. Yeah, but the federal government has always, hired outside private contractors to do, auditing and stuff like that. But there should be a little bit more controls on there. Hey, but if he's able to find fraud, waste, and abuse, then that's great. But as I said yesterday in my video, that's not going to save Social Security. Is there fraud, waste, and abuse in Social Security? Yes. Social Security employees find fraud, waste, and abuse. My office won many awards because we found a lot of fraud, waste, and abuse. And it's found every single day, obviously. Come on. But is that going to move the needle in terms of saving Social Security over the long run? No, it's just not. And we are delusional to think that it is. I just got approved for SSDI and haven't got my first yet. Will I start getting my check soon? I certainly hope so. It really depends on the level you were approved. If you were approved in the initial stage, usually everything is quicker that way. If you used a lawyer, then it might take a little bit longer because they have to pay the lawyer first and everything. If you were approved at the administrative law judge, the third phase there, then they have to go, there has to be written up and then has to be returned to the judge for sign off. And then it has to go to the regional office. And so, yeah, it really depends on what level you were approved, unfortunately. But regardless, it should happen sooner than it will happen. And the reason it's not happening is because Social Security is at a low staffing level, worse than 50 years. Last administration had the Medicare program running out and 2030, what they were going to run out of money. Yeah, the Medicare program is another program that essentially will be hurting in the future that we need to address. Absolutely, 100%. Medicare is inefficient. The information system relies on a lot of manual processing. That is not only ineffective, but also full of errors. I agree. Yeah. If Elon can come in there and make the Medicare billing system a lot more efficient, perfect. 2.7 trillion sent overseas through Medicare and Medicaid. I'd have to, yeah, please, in the remarks, if you're able to find the reference for that, please put it in the remarks once the video is done here. I came in late. No, you're right on time. Have they officially announced cuts to Social Security and Medicare and Medicaid? No. Well, they officially announced that they're going to cut Medicaid and by extension Medicare for a lot of people. Not Social Security yet, but this is the early stages. It was just announced. That's why I wanted to jump on here and put up the phone numbers for you to call and protect those that need protecting. If they stop SSI, they're going to need some mental health hospitals everywhere. Yes. There's a lot of people on SSI, and the most you can get on SSI is $967. So it's not a whole heck of a lot. But remember, those people that are in SSI are also what's called categorically eligible for Medicaid. So if you're on SSI, you can go to the Medicaid office, is usually called the Department of Social Services or Department of Welfare in your particular state, and apply for Medicaid. Um, they need to audit the Pentagon. Start there. They haven't been able to pass an audit for 7 years. Yes, that's a lot of money in the Pentagon. I agree. That's yeah. If they're in all, in all, private companies, public companies, there's fraud, waste, and abuse in every company. I mean, people say, oh, there's this whole thing about Social Security numbers and multiple Social Security numbers. How many people out there have had to correct their earnings record because someone else, legal alien, whoever, worked under your Social Security number and those earnings went to you? How many times has that happened? Do you know that's happened? If we've, had probably maybe a dozen of those a year. Um, but how many do you know that someone used your Social Security number to open a credit card or buy something? I would guess that was a lot more fraud, waste, and abuse, and those are private companies, Visa, Mastercard, whatever, whatever, Walmart or Target. Someone open up a credit card or stealing your identity. They just happen to use a Social Security number because the Social Security number has become the default number, which it never should have. But in terms of fraud and using that Social Security number, the only way the only way it affects Social Security is if that person uses your Social Security number incorrectly and pretends they're you and works at Walmart in Topeka, Kansas, and those earnings go to your record. That is the only type of fraud in terms of using your Social Security number for Social Security. But in terms of credit, that happens. I'm sure there's tons of people here that they know someone that it happened to. So they need to, the private people, the private companies that do credit need to do a far better job. So, and Social Security needs to do a better job as well. Social Security wasn't supposed to be touched. They borrowed from the money, and now they're saying Social Security is broke. Well, it's not broke right now, but the issue is the $2.6 trillion, which it's at right now, 2.6, $2.7 trillion. The problem is it's covering the gap. So right now there's X amount coming in through FICA taxes, but more going out. It's about 100 billion. In 2023, it was $70 billion shortfall. So where did they get that $70 billion from? From the trust fund, from the savings. So if you're getting Social Security benefits right now, you're getting the trust fund. A percentage of your Social Security check is coming from the trust fund. The problem is that trust fund, that savings that covers the difference, is going to be gone. As of right now, if we don't do anything, 2034, probably a little bit earlier now. If President Trump gets some of the stuff he's talking about, no cuts or no taxes on Social Security, no taxes on overtime, no taxes on tips, then the cuts are going to happen sooner and they're going to be deeper if if that money isn't put back into the system. So Social Security is not broke right now, and it won't be broken. Social Security will always be around, but the thing is, in 2035, you only get 70% or so. So your check will be cut by, 30%, 25% or whatever. So you'll get a smaller percent than what you thought you would, unless we fix it. So that's why we need to get active and reach out to our politicians and tell them to fix it. Let's see. I haven't heard from anyone on what they will do to SNAP because I rely on the program for my family. Yes, that has always been a target. Those welfare type benefits, SNAP, food stamps, those are always been a target. And yes. Let's see, finding fraud and stuff. Then why is Imam Muskin there with no supervision? Apparently, you didn't do a very good job. Oh yeah, yeah. I was the commissioner of Social Security. I ran everything in Social Security. Yes, yes. You delusions of grandeur for me. Yeah, I didn't run the entire Social Security Administration. So they are only cutting benefits from programs they don't like. Yes, yes. I'm worth VA healthcare. Once I get SSDI, should I get Medicare? Okay, so you have VA healthcare. So do you have TRICARE for life. So did you retire from the military and you have TRICARE for what life? If you have TRICARE, then yeah, you have to get Medicare Part A and Part B. If you just get, you're like me, I only served 8 years in the Marine Corps, which is like 30 years in the Army. But anyway, but if you're just getting regular VA medical, not TRICARE, then if you get money from Social Security, you have to get Part A once you turn 65. So that's, Medicare Part A, that's automatic. I know where you're going with this, Willie. You have VA medical and you're happy with it and you don't want to have to pay the $185 for Part B. I understand that because you're happy with your health insurance from the VA. But there's a way you can kind of have your cake and eat it too. Because you don't know, those are one of the cuts is VA medical. So you might be happy with the VA medical system right now, but that might change. You might move, whatever the case may be. You might want a second opinion in the future. So it's good to have kind of a fallback there, and Medicare Part B is part of that fallback, but you don't want to pay the $185. There are programs, these are Medicare Advantage plans. They're called Part B Give Back. And a lot of them are focused on people like you, veterans. That's why they call these plans, they call them honor plans or patriot plans. And they are 0 premium per month for the premium, and they pay for part of your Part B. It depends on your particular area. They might pay $50 of it, $100 or $185. It depends on what's available in your particular area. So you can, reach out to whoever you know, or you can reach out to chapter there, and they can find if there's a Medicare Part B give back plan in your particular area, and that way you're covered in case anything happens. Because remember, if you stop your Part B, if you cancel your Part B and then decide later, a year, 2 years, 3 years later, to go ahead and sign up for Part B again, you're penalized 10% for every 12 months you did not have Part B when you were supposed to. And that 10% is forever. So if you, go without for 3 years, that's a 30% on, 30% times 185, the monthly premium. So you'll have to pay that extra premium for the rest of your life. So it's important that you do the right thing at the right time. So DC may get their FMAP matching percentage cut from 70 to 50%, $3 billion reduction in federal funding. Okay, yeah, not too familiar with all of that, so I'll skip that one. I'm excited about the disclosure tomorrow of all the corruption that Elon has found so far. Crooks are running scared. Yeah, he's got on his X, he's got a Doge website where he shows the savings. But I checked it out, and it just shows the alleged savings. There's no, there's some that obviously when he closes down a department, an agency, then, number one, does he have that those are savings. But as of so far for Social Security, there's 0 savings so far. So stop lying to people. Okay. I do have hair. Okay. Is that what you mean? Yeah, I looked like Brad Pitt when I was younger. Do you mean? Yeah, anyway, but this is what happens when you have careless, fraudulent spending. Elon is finding billions in all these departments. Okay, awesome. 100% for efficiency and cutting out fraud, waste, and abuse. 100%. Thanks for so much for what you're doing. So many people will not have access to this information. I continuously pass this information on to family, friends, and anyone I come in contact with. Facebook. Oh, yeah, thank you. I appreciate it. Yeah, there's because Social Security is so understaffed, a lot of people are missing the money that they're entitled to. They don't file for the right benefits at the right time. They don't know that you can file for retirement and disability. They don't know about independently entitled divorced spouse benefits, and yeah, there is so much out there. All right, let me see if I can find a Social Security type question. Social Security denied appeal without even looking at DOD approval. We submitted. Hearing requested, sent Department of Defense approval. Are we talking about military? It clearly states not able to be self-sufficient. Why wouldn't this have been considered? Yes, the Social Security Administration criteria for being disabled is completely different than the VA, Department of Defense. So in my office, we had about 100 employees, and a lot of those were veterans, and they were receiving disability benefits from the Veterans Administration. But for Social Security, none of them were disabled because they were working, right? The guy that started Social Security, FDR, he wasn't disabled according to Social Security. He started because he was able to work, even though he had polio and was in a wheelchair. So Social Security has different criteria, and their criteria is inability to work based on a disability that's going to last 12 months or end in death, 12 months or longer. But if he was denied, okay, they denied the appeal. Remember, there's several appeals. So you file for disability benefits the first time. That's the initial claim. You get the decision letter and you file an appeal within 60, 65 days, but there's exceptions there. And then you do the reconsideration, the SSA 561. You might have already done that. And then if you're denied there, then you file the SSA 501, which is a request for an administrative law judge. And unfortunately, that takes forever. If you're denied at the administrative law judge, then you can appeal to the Appeals Council in Falls Church, Virginia, and they will review the ALJ, the administrative law judge ruling, to determine whether they did everything correctly. And then you can go to federal appeals court, and then you can go all the way to the Supreme Court. And then, unfortunately, that's the end of it right there. But yes, 100%. If you disagree, if you think this person cannot work because of the disability, please, 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 yes, appeal it. My attorney wouldn't return my calls after the settlement, and Ed gave me what I needed to move forward from SSI to Social Security. Oh, okay, perfect, good. Yeah, the attorneys, the disability attorneys, I've done several videos on filing for disability, the entire process, tips, tricks, and secrets. Disability attorneys, they're very selective. You know, it's a business. So they look at your case and they see if it's going to win. And number one, even if it looks like your case is a slam dunk, if you just got in a terrible accident yesterday or got diagnosed with stage 4 cancer yesterday, they're not going to take your case, even though it's a win, because there's no money in there for it, because they get part of the back pay, 25%, or this year it's what, 90, they just jumped it up to $9,200, I think it is. So yeah, this is a win, but there's no money in it for us, so we're not going to do it. File yourself. So, but most of the time, if you want to use an attorney, use an attorney. But for the initial, you can do it yourself. File it online. That way you're not rushed. You fill it in all in. Watch my videos on filing. You'll do the same exact thing as an attorney does, is answer the questions. So, and then the reconsideration is even quicker. That takes about 5 months to file 5 minutes to file a reconsideration the second. Once you hit the administrative law judge, the third level, yeah, then I would definitely recommend a lawyer, 100% then. So I got to stop saying 100%, 100%. I got to come up with another. Anyway, Dr. Ed has some wonderful knowledge to pass along. Been listening for a long time, but talk about divisive. Can we can we all call? Yeah, my divisive is anybody. I try not to alienate particular, left wing or right wing or anything like that. I've got my own views, but nobody cares. If someone on the right wing supports Social Security and does the right thing, I'm 100% supportive, because I don't want to people say, "Oh, Ed, I don't want to listen to you anymore," and then 3 months down the line, they might get some information that, okay, I hate Ed, but this is good information that I can help friends and family. So that's why I try to stay neutral. I have very, very strong opinions, and I could tell you, but you don't care. People are saying we should ask questions and not just comment. When you think about the future for your children and Social Security, how do you feel, Dr. Weir? Yeah, we've been kicking the can down the road to solve Social Security issues for, since the 1980s, and politicians just aren't stepping up to the bat, and we're not making them step up to the bat to solve the future cuts. So I tell my children, anyway, Social Security is only a third, one leg of the stool. You got Social Security, you got your, pension, which, pensions are pretty much, non-existent anymore. And you got your own savings, your 401ks or whatever the case may be. So yeah, I've always been super, super optimistic. I've been saying for decades, politicians will fix it, but it's crunch time. and nothing, there's nothing right now that looks like it's going to fix it. There are many proposals. There's many ideas. There's tons of ideas. I talked about them yesterday. It's an easy fix, but the political will is not there. And I check Congress.gov every day, and I say, well, maybe Senator Larson has a proposal, but it's not going anywhere. So unfortunately, yeah. But I am still going to be optimistic, and I'm still going to say, hey, we can try, can't we? I can't lose my Medicare because of a specialized surgery and needed my docs. What do you say about losing Medicare to Advantage? Um, Losing Medicare to Advantage. Oh, so okay, I see what you mean. So you have original Medicare, um, but you also have a Medicare supplement plan, a plan N or a G or an F or whatever the case may be, and Um, perhaps you can't afford the monthly premium for the Medicare supplement anymore. So unfortunately, that's what a lot of people, later in life, when their budget gets smaller and smaller, they just said, I can't afford particularly those with F, where the premiums are going up for a lot of people. Um, but yeah, if it's just not in your budget anymore, then you just might have to switch to a Medicare Advantage plan, which is fine. You just have to, well, they've got the authorizations and the networks. They need to be a lot better, but at least find the one in your particular area that's best for you. And what you do when you look for a Medicare Advantage plan is number one, don't go for all the bells and whistles, the grocery card and the gym membership. Go for the doctors. Find the plan that covers as many of the doctors as you'd like to keep seeing. Next, find the plan within that covers your prescriptions at the best possible price for you. And then number three, look at the overall costs. Most of them are zero premium per month, but the costs are the ongoing costs. So how much for a night in a hospital? How much for an MRI? How much for to see a doctor? How much to see a specialist and all that kind of stuff? And then look for all the cool bells and whistles about dental. That's another strategy too. If you are relatively healthy-ish, but your big issue is dental, here's another strategy. And because Medicare Advantage, you paid for this money. How did Medicare Advantage give out these zero premium plans? Is That's your money. All that money you paid into FICA all those decades. When you sign up for a Medicare Advantage plan, they take their begging bowl, they go to Washington and say, hey, MS paid into FICA Medicare all those decades, give us that money and we'll take care of it. And so that's your money. Get your money back. Okay. So if you have dental issues, then, here it is, February, whatever, you can change your Medicare Advantage plan and say, okay, I don't really need, hospital this year. Hopefully I'm good, best laid plans of mice and men, right? I don't think I need an MRI, but I really need dental. So switch your Medicare Advantage plan to another plan in your area that has the most dental. Or if you need to go if you're going to go to the hospital this year, you just found out you got a hospital stay this year or something, you need an MRI, you can now switch your plan. January, February, March, the open enrollment period. Be strategic, be smart, switch your plan based on what you think you need for the rest of the year, and then say, okay, well, but Ed said, make sure they're doctors. Okay, well, if you go to this doctor and it's your heart doctor and you're pretty good with your heart this year and stuff, but you really need dental, maybe, in October, switch back to the irregular doctors. But right now, focus on, what you need to focus on, the dental or, the overnight hospital or something like that. So you have to be strategic on those things. With Medicare supplements, it doesn't cover dental, vision, and hearing, which is a tragedy. But anyway, those the only time to switch Medicare supplement, the plan N and a G is if you want a cheaper price. So if you have like a G and you want to see if there's a cheaper G out there, you can do that 365 days of the year if you're healthy, if you pass underwriting. So all right. So again, you reach out to these guys and they'll help you out. Feel sorry for the trolls, have nothing better to do with their lives. Yeah. It's um yeah, I kind of like the kind of negative sometimes. It's kind of, yeah, it's kind of fun. So Elon is a liar and has group 19 or 25-year-old hackers hacking into our data. One of them was found to run our website. Whoa, yeah, I don't know. I don't. Yeah, I know they're very very young, and one guy was fired for giving out. Yeah, so anyway, there are late penalties for not signing up for Part A, Part B, and Part D within the initial enrollment period. Contact a SHIP counselor to learn more. Okay, good, Catherine. Um, Not penalties for not signing up for Part A, because Part A is zero premium anyway, unless you are the 1% or so that have to pay for premium Part A. And what is that? That's for people that never paid or didn't pay into Medicare for the 10 years, the 40 quarters. If you didn't, then you're going to have to pay a monthly premium for Part A. But most 99% of people, 99% plus of people, their Part A is free, and there's no penalty on that because it's free. But it's not. Again, it's not free. You paid for it, and there's gaps, but the premium itself is zero. So I should always avoid saying free when it's just you just prepaid for it. So I'm really sick of people who we off others' efforts through excess. Okay, I'm not sure what that. Hang in there, Dr. Ed. Most of us are very thankful for your guidance and info. I appreciate it. Yeah. Um, yeah, I've got thick skin. Old Marine Corps sergeant. Yeah, 17 years old joined the Marine Corps. So it's these guys suck at personal attacks. I'm gonna have to give a class on personal attacks. Super sticker, thank you very much. Purple Cat, thank you. Appreciate it for the support. Um, uh, Let me see. I'm gonna try to find a question for a Social Security type question here. Oh, another $5. Thank you very much. I appreciate it, and my son appreciates it. This is a two-man operation, me and my son. So, do you think the Fairness Act will be implemented? Yes, 100%. The Social Security Fairness Act will be implemented. It was signed by President Biden. It was supported by Biden. It was supported by Trump. It was when he was, President Trump. He wasn't President-elect Trump at that time. It was supported by both sides. It was a bipartisan support. I didn't support it, but anyway, I lost that battle. Um, I think the weapon, the GPO, should be recalculated, but I don't think they should have thrown the baby out the bathwater. But anyway, yes, but as typical Congress, they gave Social Security orders, HR 82, two sentences, do this, and correct these 3 million records. And we're not going to give you any resources to do that. So there you go. Reach out to your politicians, and yeah, tell them what's going on. I love Dr. Ed. He doesn't have to do this. We're blessed with him. Appreciate it. Thank you. You guys are awesome. Let's see here. Deductibles and copays. I might not be able to afford it if I get hospitalized. Can I still change back to original Medicare now in February, March, and get supplement plan G? How much is a premium for those? All right, the premium, the reason I always recommend plan N is because I'm cheap, and it's usually the monthly premium is cheap, but sometimes G is better, even though it's $10, $20, $30, depending on your particular state. So they're all based on your particular state, age, different things. But yeah, if you have a Medicare Advantage now, if you're healthy, you can pass the health underwriting. And what's the health underwriting is you contact, chapter, whoever, and they will ask you a couple of dozen questions about your health. And if you say, yep, I'm good, then you've passed medical underwriting. So health questions. And you can do that now. You can return to original Medicare and get a Medicare supplement. And yeah, the thing, when the Medicare Advantage plans are zero premium, you're like, what? Why would I pay, for a Medicare supplement plan G? That's, let's say it's $130 in your state. Why would I pay that when I get the zero premium? Well, if you had a crystal ball and you could tell, okay, I'm going to live the next 50 years and I'm never going to get sick, I would I would recommend a Medicare Advantage plan all day long, because zero premium, you're never going to get sick. So you chose right. Medicare Advantage all the way. But in the future, if you actually do get sick or fall or get injured or something like that, then those Medicare Advantage plans, there's $25 for that, $100 for that, $50 for that, deductible there, this, that, yeah. And then it starts adding up. And then you've got to have to deal with the prior authorizations and the limited networks. You don't want to go to this doctor. You don't want to go to that hospital. Well, too bad. You have to go anyway. So it might have been cheaper for you to actually have paid that Medicare supplement. So you need to kind of, check out both options there. Doctors hate Medicare because it takes forever for them to get paid. Medicare, no, not really. Your Medicaid, a lot of doctors are not big on Medicaid. Medicare Advantage, I think probably more doctors don't like Medicare Advantage than anything else. Because those are the ones, they have to deal with the prior authorizations and everything. So it takes a lot. With a Medicare supplement, what happens if the doctor says you need it and it's medically necessary, then you get it. They don't have to ask permission. And then they do it, and then they bill Medicare. Medicare pays, like, let's say the 80%, and then most of the time the Medicare computer system talks to the Medicare supplement computer system, whatever company you chose, and says, hey, we paid 80%, you kick out the rest of the 20%, and that's it. It's done. You never have to deal with the Medicare, whatever Medicare supplement plan you chose. People say, well, what's the customer service on this Medicare supplement plan? That doesn't really matter. You never have to deal with them. And that's always nice, never having to deal with the insurance company. And they can never deny you, as if once you enroll, they can never deny you. They can never say, well, you're too sick for us or anything like that, unless you don't pay the premium. Or, they go out of business or something like that for everybody. Then I guess that's super sticker. Yeah, thank you very much. I appreciate it. Ed, thank you for all your advice. These are horrible times, and it is wise to listen and learn things that will affect us. Keep up the great work. Thank you. Appreciate it. I'm not consciously picking the good stuff. I'm just pressing whatever number pops up here. Social Security told me today they have no access to the part of my file where it says when I might get a CDR. It is every 7 years. Been on SSDI for 10 years, never had a CDR. My philosophy on CDRs, continuing disability reviews, is FCF. Forget about it. When you get it, complete it, make a copy of it, send it out, and then forget about it again. They do have access to when your CDR time is up, but the person you talked to on the phone, I guess, just didn't know where to look for it. But it's there. It's a little bit hard to find, but it's there. But don't worry about the CDR. It's not you. It's not you. It's a budget issues. It's a budget issue. Congress gives a special allocation for continuing disability reviews, and they also give a special allocation for SSI, supplemental security income, RZs, as it's called, redeterminations. And if your particular office doesn't have the money to do, if your CDR is due this month and your local office doesn't have the money to do it, they don't do it. See you next year, maybe. So that's beyond your control. So just go on with your life. And then when it shows up in the mailbox, do it, return it, make a copy, go on with your life again. Because even if you send it in, they might have filled their quota for that particular month. They can only do 100 in your particular, that office can only do 100, and they send out a whole bunch extra because people don't return it. So they get 200 back, and yours might be the second 100, and they don't even do it. So forget it. That's why I say forget about it the second time around. So, can a debt collector with a judgment take my state tax? Yeah, I don't do taxes type stuff. Yeah, but I don't know about, yeah. Okay, here's a good one. You are a loser, Weir. All right. As personal attacks, I think that's, yeah, not very good. Come on, you can do better than that. How do we live in an era where experts are ignorant and ignorant people are the experts? Experts are still the experts. Yeah. Next time you have to go heart surgery, and it's like, yeah, I don't want anybody that went to medical school. I don't want an expert heart surgeon. What are you talking about? I've got a great mechanic. He fixes my, he's great on water pumps and basically the same plumbing, right? Yeah, I'll just go to that person. I'm sure he'll wash his tools. I'm a caretaker for a woman who just turns 97 years old. Thank you, Esther. Awesome. Happy Social Security is here for, and wisely she told me yesterday, take it a day at a time. I like it. Yes, that is my philosophy. Every day above ground is a beautiful, beautiful day. So let's see. But people need to know that if you don't have Medicaid, they can be charged a $500 deductible from their SSI, SSDI. Friend just was cause this plan, didn't know he had Medicaid. He lost the 500. Yeah, there's a lot of people, unfortunately, that because the whole system is just way, way too complicated, people get confused Medicaid and Medicare, and because some states call it different, it's Medi-Cal, and it's like, and so they don't realize what they have, and because of that, they're losing money in benefits, and that's a tragedy. That the system. That's one of the reasons I did this channel is because of that. So you know what you've got and know what is available. Because you can have the same person can have SSI and SSDI and Medicare and Medicaid and the extra help with prescription drug plan and Medicare Advantage dual plan and one of those grocery cards. And yeah, so one person can have all that and food stamps and Section 8 housing and affordable electrical assistance. So yeah, please reach out to the people, and get help. Yeah, and help them. All right. Oh, we are over an hour. Let me do two more questions. I have TRICARE Select. I will be 65 in May. I know I have to get Part A. Can I decline Part B and go with an Advantage plan and use my TRICARE as secondary? Um, you have to get Part B. TRICARE requires you to get Part A and Part B, but I wouldn't. Some people get a Medicare Advantage. Definitely do not get a Medicare supplement plan because your TRICARE is your Medicare supplement plan. There's no use in paying a Medicare supplement plan, $100 a month or whatever for something you don't need. So definitely don't do that. A Medicare Advantage plan, you can if you want. Some people do. Chapter doesn't really do that because there's not that much of a benefit for you, even though there's a lot of Medicare agents will sell you that because they make the commission, but you know eh, you're good in terms of your healthcare. If you want to sign up for a zero premium Medicare Advantage plan because there's gym membership or whatever, then yeah, I guess you can if you want. Absolutely. But there's one kind of stumbling block there is if you have TRICARE for life and you have to go to a hospital outside of the system or something, like there's a couple of extra pieces of paperwork that you have to file to prevent it kind of, because you got primary payer and secondary payer and stuff like that. So if you don't mind doing the extra bureaucratic paperwork, then yeah, go for it. Let's see here. I divorced after 19 years of marriage. He was in the Navy for 20 years and now is 65. Should I get some benefit even if I didn't go past 20 years? Yes. Tammy, please. You just have to be married to that person for 10 years if it's divorce type situation. 10 years. That's all you need is 10 years. So he is 65. And if you are at least 62 years old, you first have to file for benefits on your record, and then you can file for spouse benefits on his record. But your benefit amount has to be less than his full benefit amount. Your full benefit amount has to be less than his full benefit amount. And your question is, how do I know that? Well, you call Social Security and say, hey, I want to go ahead and file for benefits. And be careful. If he hasn't filed for benefits yet, it doesn't matter. It doesn't matter. If you've been divorced for 2 years, you can still file for benefits on his record, even if he isn't receiving benefits. You just have to be divorced for 2 years, and he has to be at least 62 years old, which he is 65, so you're good. It's called Independently Entitled Divorced Spouse Benefits. It's a long title. Independently Entitled Divorced Spouse Benefits, IEDS. So please, everybody out there, share, subscribe, and all that kind of stuff so people get this information. Share it with the people. And when you go into Social Security, sometimes the people at the front windows who are not the specialists, that are going to be taking your claim. Sometimes they don't know about this, which is unfortunate. And they say, no, your ex has to be receiving benefits. No, that is incorrect. Independently entitled divorce spouse benefits. So if you go in there and they tell you that your ex has to be receiving benefits, you tell them, no, my ex is at least 62 years old. He doesn't have to be receiving benefits. I want to speak to a Title II CS, Title II of the Social Security Act claim specialist. And they'll say, oh, yeah, yeah, of course. Independently entitled divorce spouse benefits, no problem. Easy. Well, it's not easy. It's a manual. It's but that's the Social Security employee's issue, that it's not an easy claim to take, but it's not your issue. Thank you. Oh, you rock. Well, it's showing the pump. Oh, thank you very much for the support. We got a lot of people supporting us today. You guys are awesome. All right, I am over an hour. I've gone over. I apologize. I will be back again tomorrow, and I'll think of some other topic of the day. I'll talk about that for about 5 or 10 minutes, and then we will get into your questions. So take care of each other. Have an awesome night.